COVID-19 is on the retreat.
As we look at hospitalizations, we also see week-on-week decreases, with a 54% decrease from our peak the week of August 28th.
Cases from this deadly outbreak have plummeted. Now the one question is, why the steep drop?
We think that's happening really because of the amount of immunity that's built up in the population.
Immunity, whether from vaccines or natural infection, seems to be the key factor in what may protect us going forward.
And so that's really driving down the number of people who remain in the population that are susceptible.
Before there was a safe and effective vaccine, we had to rely on human behavior. Did people mask? Did they social distance? And were they following control measures put out by the Centers for Disease Control and Prevention? Now, as the country is more vaccinated, we can better predict future surges.
Understanding where we are in the current state of the pandemic allows us to look forward to what is on the horizon and to be clear in our efforts as many people as possible to protect them against COVID-19.
But we're not out of the woods yet. Viral outbreaks naturally wax and wane, which means case numbers will increase and decrease over time.
We saw that, all the way back to the 1918 pandemic, where we had about 3 years of waves, and by the end of it, there was enough immunity in the population that it just became a seasonal virus.
When that happens, we say that the virus has become endemic, meaning the virus is always in the population, but also predictable. While there is optimism we could finally be winning the fight against COVID, one obstacle remains in place: the colder winter months. University of Washington's Institute for Health Metrics and Evaluation predicts we will see a surge starting in November to kick off our Delta winter. More people will be indoors, and we could experience waning vaccine immunity, leading to more transmission. But this still won't be like what was experienced last winter.
Hopefully, because of boosters coming in, childhood vaccination starting, we won't see a major impact from Delta because it's already here.
And even with more and more immunity in the country, it's still no excuse to let our guard down. What would you tell family or friends if they said, look, these cases drop so fast, we really don't have much to worry about?
We still have a lot of unknowns. We don't know if another variant's going to come in. People need to be ready to wear their masks again, especially if you're sick. If you have symptoms, stay home from work, stay home from school. And if boosters become available, make sure they're getting them.
Dr. John Torres is joining us now. Dr. John, I got to say, I actually had this conversation the other day that I'm probably going to be wearing masks all the time when I travel now, because I've just gotten so used to it. And I just feel like it ultimately protects us more than not with all the viruses out there. But that's just me. Let's talk about the FDA here. Getting some promising news, of course, this afternoon, authorizing Pfizer's vaccine for 5 to 11-year-olds. This is a huge step forward, obviously. Tell us about today's emergency use authorization and how soon we're going to be seeing shots in arms for young children.
And Jasmine, I don't think you're going to be the only one wearing masks. I think that's going to be the new normal coming up here. But as far as the FDA's decision, what they came up with today was an emergency use authorization for children 5 to 11 years old to get the Pfizer vaccine. And they based that off of their advisory committee, which met 3 days ago. They went through all the data. And at the end of the day, overwhelmingly, they voted to go ahead and push forward with recommendations for this authorization. The FDA followed through and issued the authorization. And now the next couple of steps are the CDC stepping forward with their advisory committee and the CDC recommending how to give this. So hopefully, middle of the week, maybe end of next week, children 5 to 11 years old can start getting it. But you can see here, the study was done on 3,100 children ages 5 to 11. There were no serious side effects detected, which is important. They basically got arm soreness, lymph node swelling, fevers, low-grade fevers, feeling a little under the weather for a couple of days. But importantly, they also found that the effectiveness was 90.7%, almost 91% effective at preventing COVID, symptomatic COVID, which is fantastic. Very effective, very safe, Yasmin.
I'm interested about how often we're going to have to be getting vaccinated. You look at the flu vaccine, for instance, right? That's something that we have to get on an annual basis. Do you foresee that happening with the COVID vaccine as well?
It's possible that it could be part of the COVID vaccine future here. But the other possibility is it could be extended out 3, 5, maybe even 10 years. Now, we had to get those first two, or one if it was Johnson & Johnson, up front, and then 6 to 8 months later, get another vaccine, a booster shot. But once we got this booster shot, I just got mine today, it should extend us out even more because we have that time period in between for our immune system to remember the virus, to start attacking the virus as it shows up, and get boosted even more to do that as time goes on. And so by getting that space, those few months in between, that's going to go a long ways towards making sure that the interval is longer than shorter. So hopefully a year at the earliest, maybe 3 or 5 years if we're lucky.
Hopefully you didn't get that booster shot in your pitching arm, because I know you always get a little bit of soreness after you get one of those shots. Quickly here, let's talk about some of the treatments that we're hearing when it comes to COVID. One of them is actually an antidepressant drug, Fluvoxamine. That researchers are saying reduces the need for high-risk adults to be hospitalized. What can you tell us about this?
And this is a drug that's been around for years. Fluvoxamine, like you mentioned, also goes by the brand name Luvox. Cheap drug, $4 a prescription, or $4 a day, is very cheap. And what they have found out is that it actually is an anti-inflammatory, can keep inflammation down from people that are suffering from COVID, and as a matter of fact, can keep them out of the hospital. 32% less likely to get hospitalized for people that were on this. And if they followed the 2 dosing a day for 10 days, it was 91% less likely to die from this as well, which is important. At the end of the day, it's not a cure. It's not the best thing going, but it's one of the things we have going, another tool in our toolbox, along with the vaccines and everything else, to try and get through this COVID pandemic.
That's all we need. Dr. John Torres, thank you as always.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.